Hello, this is Dr. Stanley Lang. Welcome to this broadcast on healing memory loss. And the reason that I wanted to bring this up today was because of a few patient encounters I had today, plus a conversation that I had with a colleague on the subject of using nutritional strategies to heal memory. And can you actually do that? I don't want to give the impression that I have a simple strategy for healing Alzheimer's dementia, because that's not what I'm talking about. When people start to experience memory loss, we don't really know what's going on. They maybe have some simple nutritional issues. They may have the beginnings of Alzheimer's disease. They may have a variety of other things. But it's been my experience that most of the time, they don't have dementia. They have treatable situations that can be addressed by simple nutritional strategies. So I'm going to share some of those simple strategies with you, kind of like an overview today. This is not going to be a lot of in-depth, just to kind of give you some insight into some of the things that make a big difference. And the thing that makes the biggest difference in brain health, especially as people are getting older and when they start to experience that their memory isn't working quite as good as it used to, is that they are deficient in the essential fats. So what are the essential fats? Well, there are two of them. One is an omega-3 fatty acid that is abbreviated ALA, and the second one is an omega-6 that is abbreviated LA. This is not to be confused with fish oil, which is not an essential fat. It's a good fat when given in the right amounts, or the variations of different sea-based oils, whether you want to have it coming from krill, or you want it coming from squid. These are all good, but they're not essential fats. And they're useful to the brain, but not essential in the way that essential fats are. Essential fat means that if you don't eat it, you don't got it. And the structures in your body that need it are going to plug something else into that spot, including your brain cells, if they don't got it. So eating enough essential fats is critical. The simplest source of essential fat, number one, omega-3, ALA, is simple flaxseed. So ground flaxseed is a great source of ALA. The simplest source of omega-6, the LA, is nuts or avocados. Now, there are lots of other sources of omega-6 because they're sold as vegetable oil in the store, and those are the kind of omega-6 you want to avoid because, by and large, they've been damaged in the extraction process. So they do more harm than good to your brain, whereas the undamaged omega-6 does considerable good to the brain. So essential fats, that's the first thing. But the second thing I've got there is other good fats. What does that mean? Well, there's a lot of other important fats that the brain uses. It likes to use high-quality olive oil, and it likes to use various parts of coconut oil. And what it really likes to use the most in coconut oil are called the mid-chain fatty acids. So when you consume coconut oil, some of what you're getting are the mid-chain fatty acids. Now, there's a particular mid-chain fatty acid that's called caprylic acid. And you can get concentrated caprylic acid and use that in a smoothie for your brain health smoothie. And I encourage my patients to do that on a frequent basis. The third thing here are key micronutrients. Now, the point that I want to make here is that people argue back and forth as to whether using nutritional supplements is helpful or not. And one of the problems with this whole argument is that people are arguing apples and oranges. And in most cases, they're arguing from a point of view where really low-quality nutritional supplements that didn't cover the spectrum of the body's needs were used in whatever research was being done in the first place. And the problem is there's just a paucity of research on what happens to brain health when you give full spectrum coverage for all of the key nutrients that the brain and other cells in the body need. Now, I can't point to any research because, as I just said, it hasn't been done. But in terms of observation, I can point out that over 20 plus years of watching people use very broad spectrum, high quality supplementation, that this does make a difference in brain health for many people. The fourth thing that I have listed, the fourth thing I have listed here are nutrients that are healthy or healing for the gut. And so what do I mean by that? Well, I mean two things. First of all, avoid nutrients that are damaging to the gut or nutrients that carry chemicals that are damaging to the gut. And then also adding in nutrients that help the gut to heal. So nutrients that are damaging to the gut would be GMO, for instance. So genetically modified organisms. These are very bad for the gut because the genetic insert itself is harmful. But second of all of these are laden with a lot of glyphosate. And so this is very damaging to the gut. And when you damage the gut, you damage the brain. If you want your brain to function right, you have to fix your gut. And if you want to fix your gut, you have to stop damaging your gut. So the first step is avoiding the stuff that's damaging your gut. And there's a long, long list of things that we could talk about there. I just gave you a big hint on the GMOs. And the last thing that I want to just point out as a principle would be probiotic foods. Now, probiotic foods means foods that are still being actively fermented. It wasn't that they're fermented, then processed, then packaged away, but they're still fermenting. And most of the best ones, except for organic apple cider vinegar, are made at home. You can get some of these in stores, and store-bought is better than nothing at all. But if you can make it at home, it's quite a bit better, both in taste and effectiveness. So there are several different ones that I recommend: organic apple cider vinegar, organic yogurt, organic kefir, and then kombucha I also recommend as a constellation of different kinds of foods that bring different probiotic bacteria to your GI tract that help to heal it. Now, they don't work real well if you keep poisoning the GI tract and you're not feeding the GI tract what it needs to heal itself, and if you're not avoiding the toxins that are damaging it. But once you do that and you start adding in these probiotic foods, it has a powerful effect on GI health, which has a powerful effect on brain health. So I hope that you found this helpful in terms of some things to think about on ways to not only improve your memory if you find that you're not thinking quite as clearly or sharply as you used to, but also preventively, even more important. What can I do to prevent memory decline? Now, I didn't even talk about other lifestyle strategies that are critical for memory health also, such as exercise and brain exercises, things like that, physical exercise. Those are all really critical too. And there's other things, but these are the things the things I just went over are most foundational in my experience. And the patients who have done this, by and large, have experienced a stabilization of their memory loss, and in many cases, improvement and stabilization of their memory loss. And this is, I guess, a little surprising to me because I would have expected some of them to go on to dementia. But so far, the people that I catch early on with this kind of strategy, when they're starting to experience mild memory loss, they've been stabilized. So I hope you find this encouraging for your own circumstances or somebody you know. I wish you well, God bless, and have a great day.